You're off now. Hi, everyone. We're going to get started in just a second. We're going to allow more people to come in and then we'll get started.
I'm fine. How are you? Are you sick? Oh, hello.
Hi, everyone. We are going to wait one more minute and then get started. Hello, everyone. We're going to get started. My name is Juliette Palin. I'm a community outreach supervisor from the Department of Public Health. Along with me presenting today will be Sydney Walker, a COVID-19 nurse and preparedness planner from the Department of Public Health. We are both a part of the preparedness program where we are here to talk about staying healthy and safe during very hot weather, and it's special for trusted messengers. And so before we get started, wanted to let you all know that this session will be recorded and uploaded to YouTube. So anyone who couldn't attend today can still get the information that we share. If you have any questions throughout the session, please type them in the question and answer box. We'll answer all questions at the end, or we'll type them to you throughout the presentation. If you're calling in and your questions are not answered, you can email publichealthpreparedness@phila.gov or call us at 215-429-3016. All righty. And so I'll just go over the agenda for today. Sorry about that. So we'll start with introduction of trusted messengers and then go into extreme heat in Philly, understanding the signs and symptoms of heat-related illnesses, followed by heat and chronic health conditions, risk factors, how you can support clients and communities in times of excessive heat, city early warning system, and then ends with information about city resources that you can share with your communities. And so we'll start with trusted messengers. The reason you are all here, we all know someone we look to and trust for information. And this could be a family member, a friend, healthcare provider, community leader, social worker, the list goes on. These people make an impact on what we think and how we act and provide us with important information. And so chances are you're that person for someone. And so we hope today that this training will help you inform and educate on how excessive heat affects your health, so you can share these resources and teach your communities how to plan, prepare, and respond to excessive heat during the summertime and beyond. And so we'll start with trusted messengers. What are trusted messengers and why are they important? They're important because you all deliver accurate information and provide resources. You communicate with cultural sensitivity while highlighting experience and expertise. You create a safe space for community members to share their thoughts and concerns and know and build trusted relationships with the community. So we thank you for all that you do for your clients and your community members. And so we want this training to be a little bit engaging, so you'll have time to answer polled questions as well as unmute yourself to give some responses to some of our discussion. And so the first question that we have that will come up as a poll is, do you check in with your clients and community members on extremely hot days? And you should see the poll come up on your screen. Yes, so I see numbers coming in. Some of you, it looks like it's fluctuating. We have half of the group with yeses and then the other half with no. And so it's really important during the summertime to check in on your clients and community members. And so we hope that this training will provide you with the resources that you need to do so. And so it's important for us to address extreme heat because as the CDC studies weather hazards, they have found that extreme heat has been the cause more deaths than any other weather hazard. And so on this slide, you'll see we have a chart from the CDC, and it shows heat causes the highest number of fatalities in the US compared to the number of deaths from winter storms, hurricanes, floods, and tornadoes, which may be surprising because I feel like a lot of times in the news we hear about the destruction from winter storms, hurricanes, and not as much of how excessive heat can be harmful to our health. And so while exposure to extreme heat, we can see from this chart, is a very serious, it's also very preventable. So knowing and understanding heat-related illness and preparing for when the weather is going to be extremely hot is key in helping your community stay safe, especially as we expect temperatures to increase in future summers. So on the next slide, to help us understand climate change and the future of summers in the city, this slide is from a report done by the Philadelphia Office of Sustainability, and it shows that summer temperatures are expected to get higher. The table helps us see how climate change and warming climate will affect Philadelphia with hotter and more frequent hot days. So you'll see on the left-hand side, the now column shows the average summer temperatures from the 1950s to the 2000s. And the later column shows predicted summer temperatures. And so we'll start with the average summer temperature. Right now in Philadelphia, the average summer temperature is 84.5 degrees. But as we look to the future, we're expected to see temperatures of an average of 91 to 96 degrees, which is very hot. For the average number of days above 95, right now, historically, we've only seen 3 days per year above 95 degrees Fahrenheit. But we already know that this is changing. So as we look to the future, we're expected to see 28 to 67 days with that above 95 degree weather. And it's almost 2 months. And then the last column or the last row shares the average number of days above 100 degrees. And right now, typically in Philly, we're not seeing degrees is above 100. But as we look to the future, we're expected to see 7 to 31 days with that 100-degree weather. And so while all these numbers might be too hard to remember, we want you to know that it's important to share information about climate change and how the city is getting extremely hot during the summertime. Because as you can see from the numbers, we are anticipating very hot days, very more consecutive hot days, and we want to be sure to prepare for these hot temperatures that can really affect the health of our clients and community members. And a slight did you know, summer of 2021, Philadelphia recorded 37 days of 90-degree weather. So we can see that the city is definitely getting hotter. Like other cities, Philadelphia is especially sensitive to extreme heat, and this is due to what is called the urban heat island effect. Urban heat islands occur when cities replace natural cooling lands with built environment features like high buildings, industrial activities, and lots of roadways, and all those features absorb heat. And the chart that you're seeing on the screen lists temperatures on the left and the type of environment on the bottom. And this shows that while the city may be experiencing temperatures you'll see in the 90s, our suburban and rural counterparts are only seeing temperatures in the 80s. And we know that cities have limited vegetation and tree coverage, and those things help with natural cooling by increasing shade and decreasing the temperature. Heat exposure also varies widely within our own city, with some areas being much hotter than others in the summertime. So in 2018, the city developed a heat vulnerability index that combined the most important factors associated with negative health impacts of extreme heat. This was a data-driven approach to identifying which cities, neighborhoods are most at risk, so we can allocate things like limited resources equitably to help the most vulnerable prepare and cope for extreme heat. And so the index was made and it combines demographics, socioeconomic status, health status, and environmental exposures in different areas of the city. And from all of this, we were able to create a heat vulnerability index map, which you'll see on the slide here. This map, it shows the census tracts in Philadelphia that are among the hottest, where residents may be least able to manage extreme heat. And so on the map, you'll see sections in northwest and central part of the city that have that lighter um, yellow color on the map. And as we get closer into the north and into northwest and parts of west and southwest, in South Philly, we see colors changing from that yellow to the orange and to the dark red. On the same day, some of those darker red areas can be up to 29 degrees hotter than some of those cooler areas from the city. And those areas tend to have a lot of exposed asphalt, not a lot of trees or green spaces. If you notice, some of the older homes in these neighborhoods have a black roof or a dark roof, and those roofs absorb heat, making the street and the block hotter. And so it is just really important, and we want to emphasize that if you have clients, neighbors, community members that live in these high heat vulnerable areas like Cobb's Creek, Overbrook, Grays Ferry, Strawberry Mansion, Hartramp, Hunting Park, and Mill Creek and Parkside, that you're helping them prepare and checking in on them during those very hot days. Help them stay safe from extreme heat by having access to things like air conditioning, limiting time outside, especially between those 11 to 4 p.m. hours, and seeking shade if they are outside, and knowing the signs of heat-related illness that will go over. And you can click on the link here or scan your little QR code and it will pull up the map. I'm going to pull it up for you all right here so you can see what it looks like when you a QR code, the PHL heat index. You can click on view full screen map and let's see. The map will, yes, you will come up. And so there are a number of different layers and assets from this web application, and you can type in your address right up top here and see where your block or where your client's block matches on the heat vulnerability index. And you can find things like cooling centers or neighborhood energy centers, senior centers, places that you can tell your clients to stay cool this summer. So you can also see things like the pools in certain areas and like that. And again, that bit.ly is bit.ly/PHL heat index. And to wrap this section up about how heat affects the city, we see a picture of two neighborhoods to show the difference in what people cope with during extreme heat. We see at the top this picture of a neighborhood in North Philly. We're seeing lots of cars, which we know gives off gas emission, making the block hotter, and we're not seeing any trees. Where the difference is, in Center City has cars on one side and lots of trees, allowing that natural cooling feature for the block to be cooler. And so next we have an opportunity for a little discussion. You can feel free to raise your hand as we go over these questions or type your comments in the chat. The first question is, as summer temperatures continue to go up each year, how do you think your clients and neighbors will be affected? If anyone wants to answer, you can feel free to, or type it in the chat. I see some coming in. Oh, yes, not enjoyable to be outside. Yes, so we'll definitely be sharing some ways to stay cool inside and some city resources that people can enjoy to stay outside less. I will move on to the next question and feel free to engage with these questions in the chat or raise your hand and we'll unmute you. The
We've
next
got a
question
question in
is,
the chat.
are there any questions about extreme heat events that you think will be difficult to discuss with your clients? Yeah, I see a question or a comment that said it would also be hard for community coordinators to canvas or to share information. And yes, especially when it's on hot days, we want to remember to first maybe have a rendezvous point. First, have a rendezvous viewpoint. So if there's going out neighborhood canvassing and you have a community partner, or you can talk with the library to make sure when people are canvassing,
Megan,
they're
are you
spending
on?
some time at that rendezvous point to get some air conditioning while they're out in the field. Also make sure people are drinking lots of water, seek shade often. And if you can have a rain date, like or a heat date, I should say, it's like a rain date, but when its temperatures are going to be very hot, if you can avoid doing a canvas during that time would be great.
Juliet.
And I do see someone allowed them to unmute, so I'll let you speak.
One of the things I wanted to say, Juliet, is it would be really helpful for this work that's done by the coordinators.
Well,
And
if you didn't get a chance to speak, you can also type it in the chat. I'll just move to this last question that we have. Will this map that we shared help you identify communities you should be checking in on? Do you have any questions about the map or how to use it? Oh, I'm sorry, Stephanie, you were speaking and I cut you off. I couldn't hear, but please feel free to share your comments.
oh, what I was going to say is, yes, the map is very helpful, but I also would like to know how the city and the health department can help the coordinators to ensure they have the proper tools. A lot of times there's events and maybe some of the smaller departments or even the bigger departments don't have tents and other items like coolers where we can bring water to kind of have that spot where community residents and our clients can have that second to be cooled down.
Hi, Stephanie. Are you able to hear me?
Yes, I am.
Okay, great. This is Rebecca. I'm one of the outreach staff for the preparedness program. Yeah, we saw, I don't know if it was you, but we did see the same question come through ahead of time. And
Yes,
so
that
we've,
was my
oh,
colleague.
wonderful. Okay, so we've already started to talk about what our capacity is to be able to help other city offices. But for sure, there's lots of information that we can share about the tips and tricks that we've done to keep our staff safe out in the field, inclusive of this training and all of that. As far as the city providing actual materials, that's probably going to depend on each program's budget. But as far as understanding the reasons behind it so that programs can advocate for their staff and keep them safe in the heat, we are more than happy to do whatever we can.
Okay.
Does that answer your question?
It does.
Okay.
I think many of our teams that go out may not have what they
Yeah.
really need,
Yeah.
and it's difficult.
Yeah, I absolutely hear you. Absolutely hear you. Yeah, Juliet's going to talk a little bit more about some strategies around that we worked into the training because of the question that your colleague sent ahead of time. Thank you.
Thank you.
Okay, thank you so much for sharing. So now I will hand it over to Sydney, who's going to talk about understanding the signs of heat-related illness.
Good afternoon, everyone. I hope you all can hear me. And I'm also not working on the fancy city Wi-Fi, so if my Wi-Fi does sound a little choppy, please forgive me, and I will be more than happy to repeat anything that isn't heard. Again, my name is Sydney Walker. I am a nurse for the preparedness program, and I'm going to start off by talking about how to understand signs of heat-related illness, because as trusted messengers, it is important to understand what's going on so you can then pass the message along to others so that you can help them understand. And we're going to provide some background. Well, we have provided, background on heat in the city, so we can also help you better understand why the weather has been so hot, so you can understand why it's important to prevent heat-related illness. And so we're going to start off first with sunburn. We have all probably experienced sunburn at least once in our life. Not only is it uncomfortable, but it can be kind of dangerous. So sunburn happens when your skin has too much exposure to sunlight. The skin will start to get painful, red, and warm to the touch. And then if bad enough, can cause blisters to form on the skin. Sunburn draws fluid to the surface of the skin and away from the body, and if severe enough, can cause someone to become severely dehydrated, and in the most severe case, can cause someone to go into shock. Okay, and so if you do have sunburn and you are experiencing that painful red, warm skin, and even something that extends to blisters on the skin, it's important to stay out of the sun until that sunburn heals, because you don't want to just keep re-injuring that already hurt skin. You want to put cool cloths on those sunburn areas or take a cold bath, and then put moisturizing lotion on those sunburn areas. And it's really important also to not break those blisters. I know as humans, we just have that Dr. Pimple Popper kind of urge, but it's really important not to feed into that, because essentially you could introduce an infection to your body, and that would be counterintuitive in this situation. But it's really important to also wear sunscreens, sunglasses, and wide brimmed hats, because of climate change. We are seeing an increase in more UV radiation from the sun. And so it's really important to do even more than maybe you've done in the past to protect yourself from the sun. So wearing that wide brim hat, sunglasses, and using sunscreen that's SPF 15 or higher, and applying that sunscreen 30 minutes prior to going outside, and continue reapplying according to the package's instructions, will really help keep you safe during the summer. And just a quick little tip, look for sunscreens that have broad spectrum UVA or UVB protection on the labels, because these products do work the best. All right. So now there's muscle cramps, or again, probably something we've all experienced. Kind of a lot of people will describe them as a Charlie horse. You might catch them in your sleep and they're very painful. But muscle cramps may be the first sign of a heat-related illness. And the symptoms may include heavy sweating, painful spasms that often do have to happen in the abdomen, arms, or calves. And so if this does happen, and you're doing some type of physical activity, you should stop the physical activity, move to a cooler place, rest, and hydrate. And then someone should seek medical attention if the cramps persist longer than an hour, or if you're someone with heart problems, or if you're someone who's on a low sodium diet, because the muscle cramps could be an indication that something more serious like heat exhaustion or heat stroke is occurring. But if you're also someone who is on a special diet that's not listed on this slide, like the low sodium diet, you could also be someone who's extra sensitive to hot weather. So make sure you're talking to your provider if any of your health problems, medications, or diet restrictions could put you at an increased risk of experiencing a heat-related illness. All right, so there's heat exhaustion. Heat exhaustion happens when your body overheats and it's now having a more difficult time cooling itself down. And so heat exhaustion can develop after a few days of being in very hot temperatures, or when you haven't had enough fluid to drink. So for example, you're sweating too much and not intaking enough fluid, and so there's a bit of an imbalance there. Symptoms might look like heavy sweating, headache, weakness, fatigue, dizziness, fainting, nausea, or vomiting even. So what you should do if you do think that you or someone that you are with in the community is experiencing heat exhaustion, you should rest in a cool air-conditioned space, or if you don't have that available, shade is also a good option. Sip cool, non-alcoholic beverages, take a cold shower or cold bath. And again, if you're out in the community and you don't have, and you're with someone and you don't have those things available, even using a cool cloth or wetting a paper towel or a t-shirt or something of that nature and putting it behind someone's neck, under their armpits, on top of their forehead or in the groin will help cool that body down quickly. And then someone should seek medical attention if the symptoms worsen or last more than an hour, because that might not be heat exhaustion, could be something more detrimental like heat stroke. We're going to talk about that right now. So heat stroke happens when the body becomes unable to control its own temperature. The body temperature will rapidly rise, sweating mechanisms fail, and the body's unable to cool itself down naturally. And so heat stroke is the most serious heat-related illness, and it can cause death or permanent disability if emergency treatment is not received immediately. So the symptoms may look like a very high body temperature, something that might be above 103 degrees Fahrenheit, red, hot, dry skin because there's no sweating that's occurring, confusion, a throbbing headache, nausea, unconsciousness, or fainting. And so if you think that someone may have these symptoms, it's really important to call 911 immediately and then move them to a cool place. While you're waiting for 911, it's also helpful to cool that person's body down by any means necessary. You know, by those modalities that we mentioned in the previous slide of helping them get a cold bath or using cold cloths or even dousing them in a cold water bottle, just any means possible to help cool their body temperature down while you're waiting for help. Okay. So I know I just went over a whole bunch of symptoms and, you know, what to look out for. You don't have to, you know, go to nursing school like I did. Essentially, if you think that a client or community member or someone you're with is experiencing a heat-related illness, it's important to call 911 immediately. So if you think it's an emergency, don't hesitate to call 911, help cool them off and get help. Okay. Are there any questions about that? If no, I shall continue on to heat and chronic health conditions. All right. So excessive heat can worsen health conditions. And so the conditions of concern that we're going to talk about today are diabetes, heart disease, kidney disease, respiratory diseases like COPD or asthma, and then mental health conditions. And some medications like beta blockers. And so if you're with your clients and you're trying to explain to them what beta blockers are, essentially, if they look at their pill bottles and it might have a medication that ends in LOL, like labetalol, atenolol, but if it ends in LOL, it's a pretty easy indication that they are taking beta blockers. And diuretics or water pills, people might know them by. And so the water pills will probably have the might have HCTZ on the pill bottle or something that looks like or is spelled out as hydrochlorothiazide diuretic. That is considered a water pill. So these two medications may affect the way your body responds to heat. So it's essential to talk to that. You should encourage your clients or your community members to talk to their medical providers to learn more if they are in these categories or are taking in these medications on how to prevent heat-related illness throughout the summer. And so heat events can increase the risk of dehydration, heat exhaustion, and heat stroke for all people. But we're going to look at this slide to talk about who has the greatest risk. So when we're looking at risk factors, we look at exposure, social factors, and biological factors. And for exposure, the group of people that we're looking at are people who work outside, people who are experiencing homelessness, athletes, and people who are living without AC or air conditioning. And I would also like to include in here people who might have AC, but don't want to use it because they think it's too expensive to run throughout the summer. And so they're essentially just like someone without it. And so these people have an increased risk of exposure because they never have a break from the heat. So then there's social factors. So people who are living alone and people are homebound because they might not have someone who's checking on them often to make sure that they are safe during the summer. And then there's the biological factors like older adults, infants and young children, pregnant people, and people with some chronic health conditions. There's biological factors here that really can influence someone's ability to be able to cool themselves down when they're overheating. And because of these factors, that can become problematic. And so it's really important to pay special attention to these groups or these risk factors when you're with your community members, just to make sure that they're safe on really, really hot days. And so living alone is one of the biggest risk factors. So let's check on how we can help one another. Communicating and checking in with those who are at higher risk of heat-related illness can help prevent negative outcomes when temperatures are really hot. It's really important to check in with neighbors, clients, community members before an extreme heat day to ensure that they have the resources that they may need. And this can mean knocking on doors, calling, or sharing information with the people that I went through on the last slide, especially those people. All right, we can go to the next slide. And so prevention is key, right? We don't want anyone to get to the point of having a heat related illness. And so caregivers should be able to pay attention and help people stay cool and stay hydrated. And here are some important tips that I just wanted to make sure that you guys have. So we want to encourage clients and neighbors to drink plenty of water or fruit juice, even if they don't feel thirsty. Because I think a good key to remember is that if you're feeling thirsty, you're probably already dehydrated or on your way to becoming dehydrated. Avoid spending time outdoors between 11 a.m. and 4 p.m. because these are the hottest times of the day. You want to remind clients and neighbors to find a cool place to go right away if they feel overheated. And so you want to make sure that you're helping clients identify a place that they can access for cooling before the emergency actually occurs. Create a fun way to stay cool and hydrated, especially for kids. And I think Juliet is going to go through that a little further down in the presentation. And then you want to encourage clients and community members to talk to their doctors about how medications might affect their health in the summer. And so I'm going to pass it on over to Juliet for the remainder of the presentation. Thank you all.
Thank you, Sydney. So after learning about how heat affects the city and heat-related illnesses, we want to talk about how can you support your clients and community members. And so we know that you are all extremely busy people and have competing priorities and concerns. And so it's really important, like Sydney mentioned, to check on your at-risk individuals in your community. And so you can check that your client community or community member is checking off all of these that Sydney already mentioned to make sure that they're safe during the summer heat. And so we've actually created tailored trusted messenger checklists just for you. Becca will drop them in the chat. These checklists can help you monitor the health and safety of your clients, neighbors, or community members during very hot weather. So, Sydney mentions that some populations are more at risk for developing heat-related illness. And this checklist is just a quick and efficient tool you can use to learn about who you work with and who may be having a hard time when temperatures are dangerously high and the health might be affected by extreme heat, and ways to keep cool and how to prepare to stay safe at home, and how your organization can also prepare for the summer weather. And so these are all questions and tips and tricks on how to make sure that you're checking in on your neighbors and clients. And so we have tailored checklists for healthcare workers, home healthcare workers, block captains, faith-based organization leaders, people who work with infants and children, community members, and community leaders. So you can choose from the list which best fits your community that you serve. And so we're not going to discuss this, but just wanted you to take 2 minutes to think about the people, or a few seconds, I should say, about the people you work with, or maybe even some of your loved ones or neighbors, and write down who would be the top people you would prioritize to check in, and how you can help them prepare for extremely hot weather. And so summertime often means block parties, concerts, picnics. We know there's a lot of events outside during the summertime. So it's really important that you stay informed, stay hydrated, and stay cool. You can stay informed by checking the weather, especially making sure you know when it's going to be very warm and might be harmful to your clients or your community members' health. Like I mentioned earlier, it's really important that, like when we have rain dates, you also have heat dates. So on the days that there's going to be excessive heat, you have a backup plan and not to hold an event on those days to prevent people from getting those heat-related illnesses. You can also stay informed by helping your community members know the signs of heat-related illness. We'll share different brochures and newsletters that we have available that you can give out to your clients and community members. Next, stay hydrated. We've mentioned this. Encourage clients and community members to drink plenty of water and fruit juice throughout the day, even if they don't feel thirsty, and limit that caffeine, sugary drinks, and alcohol. And lastly, to stay cool, encourage your clients and community members to seek shade and air conditioning on really warm days. And for yourselves, if you're working in the field, doing home visits or canvassing, make sure your team is going out early in the morning, trying to avoid those hot hours of the day, that 11 to 4 p.m. when it's very warm. Also, like I mentioned, creating that rendezvous point. So if you can talk to a community member or a library where while people are canvassing, you can meet there to get a break from the heat. And so next, we're going to go over the early warning system that the city has in place. As trusted messengers, it is important to understand the city's warning system. It just lets people know when they should be concerned for their health during extreme heat events. And we'll be sharing these slides so you all can look at the difference between the days of the heat caution and heat health emergencies. But I'll just talk about what happens during a heat caution and what happens during a heat health emergency. So during a heat, that's activated, public messaging and partners are put on standby. who offer city services to people in the city. And so you can sign up to get these messages in our response partner network at bit.ly/PHL community response. So you can receive those public health messages when a heat caution happens. So you can let your communities and clients know when to stay safe. Next is our heat health emergency, and PDPH, or the Department of Public Health, will declare a heat health emergency when that summer weather is dangerous for the public health. And this system is about protecting the people that are most vulnerable to heat illness. And the city uses the heat index that we went over a little bit earlier in this presentation, and not just the temperature, to determine when to activate an extreme heat event. And during those events, the city services will be activated, like the Philadelphia Corporation of Aging heat line, and PDP mobile teams will be sent out to our high vulnerability index areas. The cooling centers will be extended, so those hours will be extended, and then PECO will halt utility shutoffs for residents in a non-payment status. And to sign up for alerts, we definitely recommend sharing this Ready Philadelphia. That's the text to Ready, PHIL, to 888-777, or you can visit phila.gov/ready. How can your organization plan to keep your clients safe? So this next section, we're going to go over a number of different resources, and we'll also be happy to send these out in an email to you all so you can share them with your clients and community. The first resource that we have is the Philadelphia Corporation of Aging, also known as PCA. They expand their call center for people to get heat safety tips. Health department nurses can speak with your clients or you about medical problems related to heat and resources and services that they might be eligible for. Also to know, a mobile team consisting of a nurse and a sanitarian may be dispatched to persons home for further assessment. And that PCA helpline telephone number is 215-765-9040. Another great resource that PCA offers is their emergency fund program. And so the emergency fund program is for older adults who need assistance with things like utility assistance, food, and general need like medications, eyeglasses, and appliances. And applications are accepted from our trusted messengers, so community organizations, social workers, members of clergy, on behalf of clients in the community. And so for more information, or if you would like copies of the referral form sent to your organization, you can contact us and we can send you the applications along with a little fact sheet about the eFund, or you can contact PCA directly at PCA Helpline, capitalize the S in supervisors, at PCAcares.com. We have a few little home tips, because we know not everyone knows helpful tips to get them through extremely hot days. So it's really important to share that if your client or community member uses a fan, to remember to use a fan when outdoor temperatures are cooler than indoor temperatures, placing that fan in the window and letting that cool air blow in. But it's to note, reconsider using a fan when indoor temperatures are hotter than 95 degrees, because then the fan is not bringing in cool air, it's just blowing that hot air around the home and can be more harmful to someone's health. Next tip is, if your client or community member has multiple levels in their home, encourage them to spend time on lower levels, which are typically cooler. Also encourage them to close windows, curtains, blinds, especially during the hottest time of day, typically that 9 a.m. to 4 p.m. And lastly, avoid using an oven or stove during very hot weather, which we know can heat our home. And so next slide just shares some of the great city resources that we have. First are our cooling centers. Cooling centers are free public air conditioning spaces that stay open late during heat health emergencies. And so they could be things like your rec center or local free library. You can contact 311 or check out the map that I showed you earlier to find a cooling center near you. Next, our public pools are now open. So this is a great way for families to cool off on really hot days. The city pools also offer free swimming lessons. So contact local Philadelphia pools to find out that information for swimming lessons. For more information about the pool opening schedules, you can visit phila.gov/PPR. And then lastly, you'll see a picture of our spray grounds, but we have spray grounds around the city to help people cool off. The spray ground to find a spray ground near you, you can visit that bit.ly/spray ground finder to locate a spray ground in your neighborhood. The city has a number of museums and historical sites that are great ways to spend indoors during really hot weather. I remember seeing a comment about staying indoors now that the weather is so hot. So Artreach is a great resource to share with your clients and community members. You can visit art/reach.org for a location, but they provide $2 admission with access and EBT cards, and some of our participants also free admission. So those are Please Touch Museum, Philadelphia Art Museum, UPenn Museum, and the Eastern Penitentiary History Site. So we definitely want to encourage your clients and community members to visit our local museums. We've been talking a lot about air conditioning. It's getting hot, and we know that not everyone likes to turn on their air conditioning when it's hot, but as trusted messengers, this is a great way to help members who are really impacted by time who can't afford to run their air conditioning. So you can encourage them early to apply for some of these utility assistance programs so they can stay home safely and comfortably in their homes during really hot weather, or even in the winter time when they need heat. We have brochures available for distribution if you would like them in mass production with all these different utility assistance sites. A few more resources we have to offer. Last year, the Philadelphia Department of Public Health developed the Extreme Heat Guide, and that was in partnership with Office of Sustainability. And so anyone can go to www.gov/heat to read about extreme heat events any time of year. The site has information on who is at risk of extreme heat events or heat-related illness, heat safety tips, information about climate change, and a number of downloadable printable resources in multiple languages you can share with your communities. And then lastly, most of the information from this presentation is available in our summer preparedness newsletter. We also have created, you'll see on this slide, heat brochures. I mentioned our utility assistance brochures, and we have flyers about staying safe in the heat for special populations like infants and older adults and people working outside and more. So We definitely recommend checking out these resources. All of these can be translated into multiple language, so please feel free to order printed copies in bulk. We can mail them to you so you can share with your clients and community members. I'll drop the bit.ly for materials and copies is bit.ly/PHP materials. Or you can message at 215-429-3016. And lastly, stay connected with us. You can send us an email at publichealthpreparedness@phila.gov, or again, leave us a message at 215-429-3016 to make sure that your clients and community members are staying healthy and safe during summertime and have the resources that they need, and the resources that you all need to train your clients and community members on how to stay safe can all be accessed on the Extreme Heat resources. So that's www.phila.gov/heat. And again, if you're not already signed up to receive up-to-date text alerts, sign up for Ready Phila to 888-777, and then join our community response partner network to stay informed. Now I will open the chat and check with our team to see if there's any questions that we can answer.
Thanks, Juliet. We have a number of questions. We'll try to get to as many of them as we can. Here, let me turn this on. We'll try to get to as many of them as we can, and any that we don't get to, we'll send out afterwards with all the materials. But we have a question asking, this year we are shifting away from cooling buses. Can you elaborate a little bit on the role of libraries as cooling centers? So two things. When there is a heat emergency declared, many libraries are listed as cooling centers. Some cooling centers are not libraries. But for libraries, essentially that means that their hours will be extended. And this list will be posted once the heat emergency is declared. It can't be posted before then because, as you know, many libraries are older buildings with older HVAC systems. There's staffing considerations. So once all of that is figured out, they'll be able to post that list. Libraries, however, even if it's not a heat emergency and it's just a general hot day, they're air conditioning and they're safe public places for people to go and for you to encourage folks to go to throughout the day for their normal business hours. We have a couple of questions as well. There was a question asked if people should be trained in CPR. So what we'd advise is that, especially for community health workers and folks out in the field, it is a useful training to have. But I'd also say for anybody who has a chronic health condition or cares for somebody with a chronic health condition that puts them more at risk for a cardiac arrest, having CPR is generally a good training to have. So that's what we would suggest for that. There was a question, and I'll put this link actually in the chat for everyone. There was a question asking, and I believe some folks saw in the chat, what is the city doing to increase trees, green spaces, and natural cooling methods to neighborhoods that need them? If we know this is a problem, then our infrastructure should be designed to best support people. That was very well said. Perfectly eloquent. I'm going to pop in the chat the resource from the Extreme Heat Guide that Juliet shared that talks about the programs from the city that are addressing this. And you all have asked wonderful questions. We have another question that is asking about risks related to sunburns, including skin cancer and direct exposure to the sun. So Sydney provided this answer. Sydney, do you want me to continue or do you want to answer it yourself?
Oh, you're more than welcome to continue. Yeah, thank you.
All right, cool. All right, no problem. So Sydney mentioned sun exposure helps with vitamin D, helps produce vitamin D, which can help with calcium absorption for stronger and healthier bones, which is one of its benefits. However, unprotected exposure to UV rays can cause damage to the skin, the eyes, and the immune system. So this can also increase the risk of skin cancer, excuse me. Sunburn and excessive UV light exposure can also damage the skin as well, which we know. Skin damage can lead to skin cancer or premature skin aging. So we'll send these out as well written down so folks can absorb the information. And those are, see, there was a question about fans and AC distribution. We would love to know more and more programs about fans and AC distribution. The resource that Juliet shared from the Philadelphia Corporation on Aging is the only INVEST resource that we have for something like that. So we'll make sure that that information goes out in the slides. Thank you. That slide's coming up now for folks to see. And another question just came in the chat for city canvassers. Are there any materials when thinking about uniform or even tabling services that we should consider for future uniforms or just in general? We would probably say that the general advice of wearing loose clothing, covering your head, wearing sunscreen, and bringing with you everything that you need in order to stay cool out of the field, like a personal fan, cold drinks. That would be our advice, as well as especially for canvassers, to make sure that you all have a rendezvous point that's set up ahead of time, that's air conditioned, that's a safe, easy place to go into. So when you are feeling like you might be starting to get overheated, you know exactly where to go and don't have to start hunting around for a place in the heat. We have a couple more questions. Sharing resource bodies. The price, yeah, again, so the question about free or low prices for AC or fans. Yeah, this is why with our heat information, we push utility assistance so much. And we have a utility assistance brochure that's translated into many languages because we have not found, other than the PCA program, a way for folks to get free or low cost ACs or fans. But hopefully with people signing up for any and all utility assistance they might be eligible for, they'll then be able to afford and feel more comfortable staying cool in their homes, being able to run their air conditioning and turn on their fans and be able to afford to purchase them. And we absolutely wish there was a better answer than that, and we will keep hunting. I'm going to check, and I see we have just a couple more minutes. If I missed any questions, please feel free to raise your hand to be unmuted or put it back in the chat. But otherwise, I'm going to turn it back over to Juliet to close us out.
Thank you all for attending our training, and thank you for being trusted messengers and doing the work in the city. Again, to access our resources, I think Becca put in the link if you want to send out or if you need information in bulk, please feel free to either send us an email or go to the link to material request. Again, remember that we can we translate all of our materials. So if you have populations that need information other than English, please follow up with us. Again, if you have any questions, use the email address here or leave us a message at 215-429-3016. And remember to stay cool while you're out there in the city heat. Thank you all for joining us. We'll be sending out an email with the slides along with some more resources. Have a great day, everyone.